I hope you're enjoying these videos and getting some useful information. But if you would like the full, complete program on how we actually permanently fix any kind of body dysfunctions or body aches and pains, then please go to correctivemechanics.com and download your free ebook where we explain the entire process and how it works. We also have a body and balance membership-based program that allows you to use all of our videos, all of our images and examples and walk you through step by step on fixing your specific ailments and imbalances. Hi everyone, Brian Meadows here from CorrectiveMechanics.com. I want to welcome you to my two-part series on elbow pain, also known as epicondylitis. In this two-part series, I'm going to go through describing what the two most common elbow pain issues are and what you can do to identify them, why they're causing you pain, and what you can do to help alleviate that pain and reduce the inflammation that's been caused. Contraindications are your elbow is hot, inflamed, and you're having a fever. You can't bend your elbow at all. Your elbow looks deformed, or you suspect that you have a broken bone. If any of these are there and present, then you should seek care immediately. If you don't have these contraindications, try these techniques in this program, as they can help you out and alleviate that pain and get you back to normal. But if after trying these techniques for a good day after day for at least a week and not seeing any improvement, in fact, it's just as bad as it was the first day, then please go seek out care with a medical physician. I am going to talk about lateral epicondylitis, which is also known as tennis elbow. A tennis elbow and lateral epicondylitis is essentially when you're incurring pain on the outside of your elbow, the outside portion if your thumb is pointing out. And that pain occurs just above the bony part of your elbow. So if you're bending your elbow, you can feel the bone there. You'll know when you have it, but it's kind of a fleshy part here just above the bone. And that part is really inflamed. It's very difficult to even touch to some degree. It's very hard to maybe even hold something in your hands. It's very painful and very difficult, especially something heavy, after incurring some inflammation in that lateral portion of your joint in your elbow. So how does it get so inflamed that it becomes so sore and debilitating? Well, it's going to be like a lot of things, right? Which is overuse and maybe even some poor form in how you're doing any activity. So because it's called tennis elbow, this was first recognized in the early 1900s when people were playing tennis and they started experiencing this particular pain. Now, it can also happen in throwing activities, repetitive occupational activities like hammering or painting, something to that manner where you're using a lot of your wrist and your forearm. A lot of this is about muscles that are coming from your forearm and attaching across your elbow joint onto the upper portion of your arm. The most common that incurs this inflammation is the extensor brevis carpi radialis. But it's basically your muscle that's coming up your forearm, and it's the tendon that actually gets a lot of strain that's coming across and attaching your muscle to that upper bone across that point of your elbow. So what can we do about this inflamed situation and so we can get to some kind of back to normal? Well, the most common thing to do is rest. It is inflamed, it's been overused, it's been abused. So the best thing for tendons, because they don't heal as fast as your muscles do, is to drink plenty of water because they need some hydration, but also just to let it rest. Aside from that, icing it is very good. It's an excellent source of bringing down the inflammation. And then finally, what you can also do in terms of corrective exercise is use some compression. Now, you may have seen people with compression bands. They tend to wear them around their forearm, just underneath their elbow, but they keep them there. But there's something you can do with just your fingers. And it's to take those two fingers and find that fleshy part of your elbow and where it's sore, and you're going to press down, and it's going to hurt. I'm sorry, but this is just what happens when it's already inflamed. But pressing on that tendon and where that muscle and the tendon meet, just above that elbow joint on the inside, just right here on top, not too far back and not in front, but right in between, right along the side. You can tell you're going right between the muscle and the bone. That's where that tendon is riding. And the reason this works is because your tendon and muscle, because they are sore, they're spasming and they're contracting and they got a lot of tension going on. So by putting pressure on there for at least 30 seconds, you're going to send signals through the nerve system and down to the muscles and the tendons and tell it to relax. So that is another thing that you can do. I guarantee you that after 30 seconds it's not going to be as sore as it was when you first started pushing on it, but you kind of have to bear that pain a little bit. First things first though, get some ice, put some ice on there. Maybe you can get some of that inflammation down, then go into compression. And then give your arm plenty of rest. Don't go right back into doing heavy lifting or anything. What I don't want you to do is not move your arm though. It does need some kind of motion, and motion hydrates and lubricates. So you still need to move the arm. You just want to take it very, very light. Hey, if you like this video, do me a favor and put a comment down below, and even subscribe or hit that like button. And if you subscribe, hit the alert bell so you don't miss another video that I put out. But even more so, I'd appreciate it if you go to correctivemechanics.com and check out some other videos and tips and tricks that we have. And I also have available for you a free ebook that shows how the whole process of corrective exercise works and in what procedures and steps that we use, in what order. But until next time, take care.